Good evening, everyone. My name is Sue Correa, and I am one of the co-founders of the Dental Hygiene Alliance of Florida. And with us tonight, we have Dr. Charles Reinertsen. He is an amazing doctor. He's been a dentist for many, many years, and he's going to talk to us about how your oral health affects your overall health. So without further ado, Dr. Chuck, you're up.
Well, thank you very much. So it's a pleasure being with you. My goal tonight is to help you understand just how much your oral health affects your medical health, because nobody's talking about it. It's just something we don't, physicians don't talk about, most dentists don't talk about, but tonight we're going to talk about it. So oral systemic hygiene, your mouth is the front door to your body. Hygienists are the front lines for systemic disease prevention and treatment. You are the front lines. I cannot tell you how important hygienists are. Years ago, I actually opened up a hygiene practice that was simply hygiene because we had people that needed to be on a 3-month, 6-month, whatever it was, schedule, but we didn't have a place to put them. So I opened up another practice that was simply for hygiene, and it was great to keep people on their schedule. Other dentists in the area thought we were trying to steal their patients, but it really works, and hygiene is absolutely critical for oral health. So let's see here. Here's the goals for tonight is understand how painless dental infections can spread through your bloodstream, contributing or worsening diseases such as cardiovascular disease, diabetes, pneumonia, rheumatoid arthritis, Alzheimer's disease, and pregnancy complications. And there's all kinds of research to back up whatever we're talking about. I'm not the expert, but I can read. So discover why many doctors overlook the critical connection between oral health and overall health. Learn how dental bacteria impact your blood vessels, your heart, your brain, pancreas, lungs, and other vital organs. Identify key questions to ask your physician at your next visit. Recognize that you have tooth, or if you have tooth or gum infections, you can have that without experiencing any pain. That's incredible. 90% of dental infections have absolutely no pain, so the patient has no idea they even have an infection. And then gain insight into the causes of cavities and gum disease. So it's not rocket science. It's really common sense, but it's backed up by science. In the back of my book, I've got tons of links, but you don't even need that. You can just go online and search under oral systemic connection, search under gum disease and heart problems. All of these things, you can see tons of literature that shows, and this is from the scientists that have done the work. So the information is out there. We just need to get to it. Here's some of my story. It starts back when I was a Boy Scout, 1966. I got first aid training. And one of the things we learned there is you've got to thoroughly clean out a wound, because if you don't clean out that wound, the bacteria can get into the bloodstream. It can make the person really sick and even kill the person. So this was 1966 as a Boy Scout, which I had a great experience in Boy Scouts. It was really good. Things have changed, but it was great back then. Common sense is so uncommon. Yeah, think of it. This is all common sense we're talking about. When I got to dental school, some of us students went to some of the instructors and asked, what about the infections in the mouth? Aren't they going to get into the bloodstream? At this time, this is back in the 70s, we were told, oh no, there's an oral barrier that keeps them out. Just like there's a blood-brain barrier, just like there's a placental barrier. Well, there are stillborn babies that are full of oral bacteria. So there really isn't that great of a placental barrier. They're finding oral bacteria in the brains of Alzheimer's patients. So evidently that brain barrier isn't keeping out all the bacteria. And there is no oral bacteria or oral barrier. If you get an infection in the tooth or the gums, once it gets into to the end of it, it goes right into the bloodstream. So it's just, I'll say this later, I want to say this many times, but for tens of millions of Americans, the mouth is a pus factory, and they have absolutely no idea because there's no pain going on. But periodontal disease and cavities are wounds. So we don't want to tell people just go brush your teeth. We want to tell people to clean this wound. This is a wound. You've got bacteria. Wherever blood comes out, there's a hole, and bacteria can go right into that hole. So let's clean things up in the mouth, because this is, like I said, it's a pus factory for tens of millions of Americans, and they have no idea because nothing hurts. But you can take care of these things, and you can make the people aware of it. So the mouth is the front door to your body, and almost everything enters the body through the mouth. Food, beverage, bacteria, including harmful bacteria. This bacteria doesn't stay in your mouth. They enter your bloodstream. And once in your bloodstream, where does it go? This is where your bloodstream goes. Everywhere through your whole body. There's not a place that, well, your fingernails and your hair. That's about the only places it doesn't go. But other than that, it goes everywhere. Bacterial infections produce pus. Well, what's pus? It's harmful bacteria, dead tissue debris, white blood cells, and toxins. But where does the pus go? When you pop a pimple, that's pus. So the pus either goes out or it goes in. Sometimes you'll have a patient say, well, I have this metallic taste in my mouth. Guess what tastes like a metallic taste? That's pus. So if they've got that taste, hey, let's check out things out and see what's going on. So bacteria in, let's see, this is sort of the side is breaking up some of my what I can view. Anyway, the bacteria in gum disease have been proven to be causative for cardiovascular disease. This is huge. This is back in it was 2016. There was a study in the British Medical Journal where they actually proved that the bacteria in periodontal disease are causative for cardiovascular disease. That is huge. When it comes to the medical, causative is a big word. That means you take out every other factor, take out diet, take out exercise, take out everything. The bacteria is causative for cardiovascular disease. So this is a major thing. According to the CDC, statistically, if you're over 30 years old, about 50% of Americans have periodontal disease, have gum disease. And if you're over 65, over 70% have gum disease, have periodontal disease. And nobody is asking about the mouth. Physicians don't ask about the mouth. Yet this is huge. When you think of 70% of the people over 65 having the source for what can cause cardiovascular disease, and we're not asking about it. We need to do that. So we have heart attacks, stroke, heart valve replacement, bypass surgery, stents, erectile dysfunction. That's a cardiovascular issue. And look at all the numerous medications that go on with that. So really one of the things we want to try and do is help people understand that just because something doesn't hurt doesn't mean everything is okay. High blood pressure doesn't hurt. Diabetes doesn't hurt. Glaucoma doesn't hurt. Cancer doesn't hurt. So just because things don't hurt doesn't mean everything is okay. Here's the progression. And I wish I could point to show what's going on, but on the left side of this, that's a healthy artery. But as you go along, let's say you've got 5 years of gum disease going on. Well, that's the next section. Look at how it's starting to thicken up a little bit. And let's go another 5 or 10 years. Oh, look at what's happening. Some of the bacteria in fact, one of them called Fusobacterium nucleatum, that breaks down the intercellular bonds that you have on the interior wall of the artery. But once you break that bond down, now other things can creep into the wall of the artery. And that's what happened. Let's go another 5 years, 10 years. So maybe you're 30 years old on the left. By the time you get to the right, you're 45 or 50 years old. And all of a sudden, there's a blood clot that's forming. Why is that? It didn't happen overnight. People say he had a sudden heart attack. It was a sudden thing. Well, maybe it was, but a lot of times it's been growing. It's just been growing symptom-free. You didn't know what was going on. So this is something that takes years to happen, but the consequences are huge. Other diseases caused or worsened by harmful dental bacteria. Diabetic complications. Well, with diabetes, it's a bidirectional relationship. When your gum disease is bad, your diabetes is bad. Get your gum disease under control, it's a lot easier to control your diabetes. That's a bidirectional relationship. Rheumatoid arthritis, that's an inflammatory disease. Well, you got inflammatory proteins going into the gums from your gum inflammation, from the things that are going in your mouth. That can affect rheumatoid arthritis. Pregnancy complications, we already mentioned that. It's from early birth, stillborn, just complications through that. Again, it has to do with the bacteria getting in, and attacking the muscles of the uterus, which is a smooth muscle, which is attacked by, again, Fusobacterium nucleatum. But then some of the other ones just get into the developing baby, which is not good. Cancer, they're showing now links between oral bacteria and certain types of cancer. Alzheimer's disease, they're finding oral bacteria in the brains of Alzheimer's disease. I think it's Porphyromonas gingivalis is the one that they're finding in the brain. So what else are they going to find? Because they're just now starting to find these things. And I shouldn't say just now, within the last 10, 15 years, but it's common sense. If you've got an infection, I don't care if it's in your arm, your leg, or your mouth. If you're dumping bacteria, if you're dumping pus into the bloodstream, it's going to have some effect on the body. And this is where hygienists, man, you're the front line on this. So you're able to, well, we're going to talk about a little later about what you can do as a hygienist, but you've got a great position to do that. Dental infections have medical consequences. And that's the thing I want to get across to you. Just because it doesn't hurt doesn't mean it's okay. Your consequence can be from diabetic complications, can be from heart attack, can be rheumatoid arthritis, can be pneumonia, can be pregnancy complications, it can even be death. I volunteer at it's called St. Louis Clinic. It's a free clinic in our town. And just yesterday, I was talking to a fella. In fact, I do this with all the people because they come in, they've got again, it's a free clinic. And a lot of these people have dental disasters. He came in about 4 or 5 weeks ago with just a dental disaster going on. Nothing was savable in his mouth. Let me put it that way. We had to remove all of his teeth. But I told him before we started, I said, once we get your teeth out, I think about how you feel now. And let's see when we get your teeth out, how you feel. Well, he was in yesterday. We didn't have all of his teeth out. We still had 4 left to go. They weren't too bad. But he came in, he says, Doc, I feel better than I have in years. You know, why? Because we removed the pus factory. And as he and I were talking, he told me about a good friend of his who was 24 years old, had horrible teeth, but was in physically great shape. He went out and worked out in the gym all the time and was 24 years old. He was working out at the gym, had a heart attack and died, just like that. This is real stuff we're talking about. So, in fact, a friend of mine was talking to the coroner of the county I'm in, and she was saying that most of the people that she sees that die with heart attacks have bad teeth. Yeah. I cannot look at somebody and say if they have good teeth or bad teeth unless you do a good examination, because you can have somebody with a beautiful smile that has horrible infections going on. They just don't hurt. How do people know if they have any dental infections? Well, they wouldn't have any pain. Well, a lot of people think you're going to have pain. No, you don't. And we've mentioned this already. Other diseases with no pain, high blood pressure, diabetes, cancer, glaucoma. These are not healthy things, but these are going on. This is, again, what people are unaware of. Here's just 3 of my patients. This is Alice. The first time I saw Alice, she was a mess. Just looking in the reception area, she did not look good. Alice was on dialysis, and they were having a hard time with the bleeding when they unhooked her from dialysis. Her medications weren't working well. She had absolutely no energy. But she hadn't seen a dentist for years because nothing hurt. She never had a toothache. Finally, thank goodness, she had a toothache. This is why it sounds funny, but I'm a dentist and I love pain. I never like to cause pain, but pain is a wonderful motivator. It really is. And so she looked for a dentist, and I happened to be the dentist that she saw. And so when I looked in her mouth, you didn't have to have a degree by your name to look in your mouth and say, it's a mess, it's a disaster. And so it really was. And we had to remove, so we put her on antibiotics, removed all of her teeth, except we were able to save her 2 lower cuspids or lower canines to make a lower partial hook onto that. Once we got her on the antibiotics, took out the bad teeth, she was back in about 3 weeks. And she says, man, this is so different. They weren't having any problems now unhooking her from her dialysis machine. Her medications were working better. She had pep in her step. She had energy now, which she hadn't had for a long time. She was an artist. She hadn't wanted to draw for the last 2 years. Now she's back to drawing. What was the treatment? Put her on antibiotics and clean up the pus factory, take out the bad teeth in the mouth. That was just one story. Debbie Went to her physician. She had an abscess on her thigh. So she went to the doctor, looked at it. Well, we'll put you on an antibiotic. It went away. And then a few weeks later, it came back. They put her on antibiotics a second time. It went away. And a few weeks later, it came back. The third time, they decided to, let's culture this and see what we're dealing with. Well, when they cultured it, they found out they were dealing with oral bacteria. Now, nothing hurt. She hadn't seen a dentist for years because nothing hurt. So she came in as a new patient. We did an exam on her. 3 abscessed teeth, huge abscesses, bone loss all over. She's looking at the x-ray. I'm explaining what's going on. And she's saying, why doesn't that hurt? I don't feel it. That's the whole point. We took care of her infections. We got rid of those. We had to do a root canal on one tooth and actually remove the other. There was so much bone loss on that. She came back in 3 weeks, and guess what? Her thigh healed up. Her leg healed up. Think about that. We work on her mouth, and her leg healed up. Crazy. Melissa was a nurse, and she was a new patient. And the only medication she was on was for high blood pressure. She went to the physician. They took her blood pressure. It was high. So they gave her a pill. Her blood pressure came down. Everything is okay now, right? Well, we did an exam on her. I'll never forget this huge abscess on the lower left second molar, big old abscess. Again, no pain. She didn't even know she had it. So we showed her it, showed her the x-ray. In this case, there wasn't enough bone to save the tooth. So we put her on an antibiotic, got the infection under control, carefully removed the tooth. And in about 3 weeks, she came back and said, guess what? I don't need my blood pressure medication anymore. Can a dental infection raise your blood pressure? An infection anywhere in your body can raise your blood pressure. Your body is fighting this infection that's going on. But what are the side effects of the blood pressure medication? Xerostomia, it dries out the mouth. When we dry out the mouth, what happens? Now you don't have the saliva to dilute the acids that are being produced from the bacteria in the mouth. So your cavity rate goes up and your gum disease rate goes up. So by only treating the symptom and not looking for the source, I don't know how much good the physician did. But this is what we want to have people do, is understand they don't have to hurt for there to be a problem. But these are real life stories. These are people in my town. You don't even need to have teeth to have a healthy mouth. But if you have teeth that cannot have any infections, either in the teeth, the gums, or for your mouth to be healthy. You look at these two. Now, which would you rather have? Well, I'd rather have the bottom, but clean it up. Get it all cleaned up and get healthy. But the top one, there's no infections going on. That to me is actually a healthier mouth than the bottom one. The mouth is only one of 5 factors that controls our health, but it's the most overlooked factor. The way I look at it, we have 5 things that affect our health. Number 1 is what we put into our body. That's food, beverage, medications, injections, vaccinations, inhalants, whatever we're putting into our body. That's number 1. Number 2 is some exercise. The body is meant to move. We're not supposed to sit still all the way. What helps our circulation is our movement. What helps we have to move. So I'm not saying you have to join the gym, but you can't sit in a chair all day long. Number 3 is a healthy mouth. And we've talked a lot about that, but that's an important thing that is overlooked by most physicians and even many dentists when it comes to your general health. A good night's sleep. Your body does its best healing when in our deepest sleep. So we need sleep for our health. That's an important thing. And number 5 is our attitude. The attitude actually controls the other 4 things. So I don't know if you can see my hand up here, but what I like to show people is, number 1 is what we put into our body. That's food, beverage, whatever we're putting into their body. Number 2 is some exercise. We need to have good exercise. Number 3 is a healthy mouth. Got to have a healthy mouth. Number 4 is a good night's sleep. And number 5 is our attitude. So when people give you a thumbs up, that's talking about your attitude. Great. And if they're showing just their middle finger, they're reminding you to have a healthy mouth. You need a healthy mouth. So next time you see somebody holding up just their middle finger, remember, they're reminding you to have a healthy mouth. That's important. As a hygienist, what can you do? Man, you're the front line. You can educate the patients right there. People don't know what they don't know. And they come in, they're totally ignorant, nothing hurts, I'm fine, just clean my teeth, and I want a pretty smile. Well, there's more to that. And this is the hygienist has the the opportunity of talking to the patient while they're working, and the patient is a captive audience. So you can really talk to the patients on that. People don't know. Their parents, their teachers, their physicians, their dentists have not educated people about the medical consequences of dental disease. Nobody has told people. As I'm working in the clinic and I'm talking with these people, it's like nobody ever mentioned this to me. When I was in my practice, when we educated people about the links between oral infections and medical diseases, their home care really improved. Once they understand, it's like, oh my gosh, so I'm not brushing my mouth just to have a pretty smile. This has to do with my heart, with my brain. Yes, it's like, whoa, I'm going to spend a little bit more time doing that. You can be the one to open their eyes, to help them connect the dots between the mouth and the body. You can be the hero. And we're going to talk about some more in a little bit about how you can do that. But this is so important to make that connection with the patient and help them understand it's not just for your smile. It's not just for a nice breath. It's not just to prevent cavities and gum disease. It is to do that, but there's so much more. And that's what I want to talk about. Hygienists, oh, I wish I could read this, but there's a bar going across the top of the screen. But again, you can help spread this information with your patients, your family, your staff, and your friends. Oh, let me just, maybe I can, well, my mouse won't work on it. I'm trying to figure out how to get rid of that line. Anyway, please share this information with them. If you know the right thing to do, but don't do it, is it wrong? Okay. If a blind person is about to step into traffic, should you stop them? When you look in someone's mouth and you see infections and you know what that infection is doing to their body or can do to their body, and you don't tell the patient, are you a healthcare provider or a tooth cleaner? That's a choice. You can be a tooth cleaner or a healthcare provider or both. A dentist can be a tooth mechanic or a healthcare provider or both. I prefer both. Do we have a moral obligation to tell our patients? I believe we do. I believe if you know something and keep your mouth shut, it's wrong. If a patient has medical issues that could be related to their dental health, should you tell them? I think so. If you want to be a healthcare provider, yes. Tooth cleaners, you don't have to. But if you want to be a tooth cleaner and a healthcare provider, you need to let them know. If you found out that a painless dental infection was affecting your health, would you be thankful to the person who told you? Yeah, you sure would be. If someone says, hey, did you know that? And they're able to, well, cardiovascular disease is reversible. I don't know if anyone was told you that, but there's books by Dr. Bale and Doneen, and they show you how it's reversible. And they got patients to prove it. In fact, in their practice, they will guarantee you will not have a cardiovascular event or you get all your money back. And their patients are mainly made up of people who've already had a cardiovascular event. It is reversible, but you have to do certain things. And one of the things they preach the most is you have to have a healthy mouth. You cannot have infections going into your bloodstream. Save your success stories. Write a book, because as you do this, we're going to talk about going through their charts and looking, gee, what medications are they on? What are they taking it for? You might be able to help them connect the dots between a medical issue they have and possibly a dental source. It's a good day when you save a smile, but it's a great day when you save a life. So how do you educate? Do you educate yourself and your patients? Number one, have a genuine concern for the dental and the medical health of your patients. It's not just, we need to look beyond the teeth. We need to look to the whole person. People don't care about how much you know until they know how much you care. And that's important. And as a hygienist, you're on the front lines. You've got the ability to take some time with those patients, talk with them, and they'll know if you're caring, or you're not. Patients, they can tell. They can tell. Do your own research. You can believe what I'm telling you, but I don't want you to believe just me. I want you to go online, start doing some searches. Look for the oral systemic connection, or the mouth-body connection, or gum disease and heart attacks, or just any of these. Use multiple search engines, though, because some of the search engines don't show you all the results. So use multiple search engines. Look for the research. I'm not the expert. I'm just a dentist. I've got 40 years experience. I watched these things happen. Like I said, in dental school, they didn't teach us about this. And in fact, they told us we had an oral barrier. But it was later on, I saw some DVDs from the American Academy of Oral Systemic Health when they held a conference at the Cleveland Clinic. And there they had cardiologists, physicians, everybody showing the links. It's like, son of a gun. That does make sense. So do your research, look on there, make sure you know what you're talking to your patients about. See, now you know something many times your doctors don't even know. Now, don't blame them. They weren't taught this information in medical or dental school. Why don't they teach this in medical school? Why do they ignore the mouth? I don't have an answer for that. I don't know. Why don't dentists tell their patients the diseases that are caused or worsened from dental infections? I don't have an answer for that. But I think we need to close the gap. We need to connect the dots. We need to start working together. I tried getting into our local hospital, this is about 10 years ago, as a dentist to do oral exams on the patients so you could rule out the mouth as a source for the bacteria that's causing their problems. I thought this would be great. I was excited about it. So I went and I applied, and they had me taking courses on blood transfusion, insulin regulation. I said, I'm not going to do any of that. They said, well, you got to take the courses. So I took the courses. Came down to a final meeting with me and about 10 of the physicians there. And they all agreed that the mouth could play a role in your health, but they didn't want me coming in and diagnosing things that they couldn't treat. I said, wait a minute. Every year, every week, I diagnose things I can't treat. I would refer that patient to someone who can treat it. The hospital's answer, we don't want to be in the referral business. Blew me away. So then I went around to local physicians. I said, can you include the mouth when you're evaluating someone's health? Because that could be the source of the bacteria that's causing a lot of their problems. I was told, Chuck, we'd love to, but we don't have enough time. Today, over 70% of the physicians work for corporations. The corporation sets the schedule. They've got about 15 minutes per patient. They don't have time to get into anything else. They barely have time to finish what they have to do. So if the hospital doesn't want it, the physicians don't have time. That's why I wrote the book. It's written for the general public, and it's easy to read, but the whole idea is let's start connecting the dots between the health of the mouth and the rest of the body so we can be healthier. I would rather be healthier. So decide how your team will share this information with your parents, with patients, with your patients. This is a team sport. And I think you can have staff meetings. You can talk about this. Hygienists, you might be able to educate your doctors about this if your doctors are willing to listen. But you might be able to educate. And once you do that, once you become a medically oriented as well as dental oriented practice, your patient compliance really increases. You hate seeing people come back and every time you see them, they got crap all over their teeth. And, it's like, why? What are you doing? Well, once they understand this and if they really grab a hold of it, they take a lot better care of their teeth. So that's kind of one of the, which is, again, shutting down the pus factory. So you can go through their dental charts, look through the connect the dots between medical and dental. What medications are they taking? For what disease? Do they have a history of cardiovascular disease? Do they have a history of diabetes? Have they had pregnancy complications, rheumatoid arthritis, pneumonia, blood pressure? Dental infections can increase blood pressure. Removing dental infections can bring blood pressure back to normal. Could these diseases be affected by dental infections, either tooth or gum infections? It's a scavenger hunt. What you're trying to do is go through that chart, see what the patient has. Then when you look in the patient's mouth, see what things look like. And if you see disease going in there, maybe you can connect the dots, but then you have to be able to talk with the patient. Sometimes we're going to talk about that in just a second, some of the questions you can start asking the patients. But this is where you can be the hero. Like we said earlier, on a good day, you save a smile, but on a great day, you save a life. And that's super. So how do you begin teaching the oral systemic message to your patients? Ask questions. Did you know that about 50% of heart attacks are triggered by pain-free dental infections? That's huge. Last year, we had over 650,000 deaths just from heart attacks in the United States. If half of those come from dental infections, that means we have about 325,000 deaths that are preventable that we're not doing a darn thing about. We talk about fentanyl, which is horrible. And look at the 300,000 people that have died from that. But this is something, and my thing is we need to teach people how to do the free stuff at home, because everybody says dentistry is too expensive. I can't afford it. Well, are you doing the free stuff? Well, what do you mean the free stuff? Are you thoroughly cleaning your teeth every day? Well, I brush my teeth. Well, how do you clean in between? Well, I brush. No. How do you thoroughly clean your teeth? You got to get all surfaces of that. And once they understand that, now we can start attacking some of the medical issues because we're removing this pus factory in the mouth. So, and when you look at the finances in this, oh my gosh, there was over, I wrote it down here somewhere. $318 billion was spent last year in treating cardiovascular disease. 318 billion. Just to give you an idea, I think the fact that million, billion, and trillion rhyme, we don't get the difference. A million seconds is a little over 11 days. How long do you think a billion seconds is? It's over 30 years. It's huge. So when we start looking at $318 billion spent on cardiovascular disease, and we know that one of the sources that can cause, there are other sources, we talk about the 5 sources, but one of the other sources is the mouth. We're not doing anything about it. We need to include the mouth when we're evaluating someone's health. Did you know that 90% of dental infections have no pain? We talked about this. Neither does high blood pressure or diabetes or cancer. These are questions to ask your patients when they're sitting in the chair. Ask your patient, did you know that the bacteria in gum disease have already been proven to cause cardiovascular disease? And just wait. Let the patient think about that for a second. See what? What did you say? If you have an infection in your arm or leg, can that bacteria get in your bloodstream? Well, yeah. Well, how about infections in your mouth? I never thought about it. Nothing hurts. Besides, everything is hiding behind the curtain of the lips. How many people really go back in there and check their molars? I mean, people can't see that. Even with a flashlight and a mirror, you have a hard time doing it. So people don't look in there. Did you know that harmful bacteria in tooth or gum infections cause or worsen many diseases, from cardiovascular disease, diabetic and pregnancy complications, Alzheimer's disease, pneumonia, and rheumatoid arthritis? Again, these are questions you can ask your patients when they're lying in the chair. It's going to start some type of a conversation. They may tell you, well, I don't want to know about this. I'd rather not know. Well, that's the patient's choice. But I think we have a moral obligation to at least bring this information to the patient. What they do about it is up to them. You can lead a horse to water, but you can't make him drink. But you can make him thirsty. Okay? And some of these questions might make them thirsty. And that's what we want to do, is help them want to learn more. Questions to ask your physician. Does my dental health have anything to do with my medical health? Ask your physician and then be quiet and listen to what their answer is. Now, if you already know the answer is yes, it does. Of course it does. But you want to find out what your physician believes. If your physician understands the connection, fantastic, wonderful. You got a great physician. If your physician doesn't, share this information with them. Links, articles, other literature explaining that. I was down visiting someone at a major hospital in Orlando, and they had brain surgery. And when I was in there visiting, the infectious disease doctor came in to inspect to make sure there was no problems. And I asked him, I said, when you're finished with him, can I ask you a question? He said, sure. So we finished, and I said, when you're looking for the source of bacteria, do you ever consider the mouth? His answer floored me. His answer was, oh no, the mouth is insignificant. I couldn't believe that answer. The mouth is insignificant. So not all physicians get it, but we need to help them connect the dots. Don't be upset with your physician, because they're doing exactly what they were taught. Okay, but we need to bring more education to them. Financial returns. Statistically, this is from United Concordia. They can show you that if you treat dental situations, just look at the hospital admissions. For diabetes, down by 39%, for strokes by 21%, for heart disease by 28%. So these are, and the financial savings, these are from a few years ago. So if we look at what the cost is now, there's much greater savings than what that looks like. When your patients realize the gum or tooth infections in their mouth can affect their medical health, their acceptance to both dental treatment and dental maintenance greatly increases. Once they get it, once they connect the dots, once they understand, oh my gosh, the same blood that goes through my teeth and my gums also goes through my brain and my heart and it's the same blood. If you have an infection in your arm or leg, the bacteria gets in there and it goes everywhere. Same thing with the mouth. So help them to connect the dots. The oral systemic is common sense backed up by research. There's tons of literature out there. You can find it. It's easy to find. Read through it. See if it makes sense. To me, like I said, common sense is so uncommon. And this is just common sense. So hopefully we want to understand how, these are the objectives, understand how painless dental infection can spread through the bloodstream, contributing to or worsening diseases such as cardiovascular disease, diabetes, pneumonia, rheumatoid arthritis, Alzheimer's disease, and pregnancy complications. I think we talked about that a little bit. And we can discuss about what bacteria does what things. My goal is helping understand, look, if we've got a pus factory, let's shut down the pus factory and let's see what happens to the body. It's amazing I don't want to split hairs about what bacteria does what things, but let's shut down the pus factory and see what happens to the body. And I think we're going to find a lot of bodies getting a whole lot better. I'm seeing it as I work at the clinic all the time. People come, man, I feel so much better. Blood pressure, other issues. So discover why many doctors overlook the critical connection between oral health and overall health. Well, they weren't trained to. It's real simple. They were trained, the dentist has the mouth, you've got the rest of the body. Dentists are trained, you've got the mouth, physicians have the rest of the body. But there's a bloodstream that connects everything. You can't separate them. Learn how dental bacteria impact your blood vessels, your heart, brain, pancreas, lungs, and all other vital organs. It builds up plaque on the inside. Isn't it interesting? What do you build up on your teeth? Plaque. What do you build up on your arteries? Plaque. Are they connected? Yeah, they really are. Are they a little bit different? Yeah, they're different, but they still are bad. Both of them are bad. Identify key questions to ask your physician. Simple thing. Does the mouth have anything? Does my oral health have anything to do with my medical health? And listen to their answer. Don't argue with them, just listen to them. Recognize that you can have a tooth or gum infection without experiencing any pain. And that's such a biggie. You know, when we look at over 70% of the people over 65 have gum disease, periodontal disease, and the bacteria in periodontal disease have been proven to cause cardiovascular disease. That's a huge thing. And gain insight into the causes of cavities and gum disease. This is silly. I ask people, what causes cavities? The number one answer is sugar. It's not the right answer, but that's the number one answer. And so what I tell people is when you and I eat food, we have byproducts. We poop and we pee. Well, when bacteria eats food, it also has byproducts. And one of those is lactic acid. Well, when bacteria sticks to the sides of the teeth, we give it a name. And what's that name? It's called plaque. Okay, so the plaque eats foods that we eat, and sugar is worse. Don't get me wrong, but other things too. So when the bacteria eats the food, I tell the little kids, it goes to the bathroom all over your teeth. It poops on your teeth, and that poop is so strong, it makes holes in your teeth. And when you think about it, if this bacteria can eat holes through enamel, which is the hardest substance in the body, and through dentin and go all the way through that, what do you think it can do to your heart? What do you think it can do to your brain? What do you think it can do to your pancreas, to your liver, to your kidneys? Yeah, this is not good stuff. So again, to the kids, so we need to remove the sugar bugs. I don't call them plaque, or I call them sugar bugs. Get the sugar bugs off your teeth before they go poop on your teeth. And they don't want poop. They might not understand some of the other words, but they don't want poop in their mouth. So, and I tell them, if you wake up in the morning and your mouth tastes really kind of funny, that's sugar bug poop. You got to really clean your teeth. So that's what I kind of have to say. I've got a book. It's called "Are Your Teeth Making You Sick?" That's the one I wrote because the hospital didn't want to have dentists in it, and the physicians didn't have time. So you can get it on Amazon. You can get it on it was a Books a Million. It's out there. But there's a website called the dentalmedicalconvergence.org. And on it, there's tons of information, links, articles, and videos from a lot of things. Look through it, check it out. And do your own research. I'm just one guy, but do your own research and let's see if we can save more than smiles. Let's see if we can save lives, because with all the money that's all the dollars are spent, those dollars also represent a lot of tears. And there's a lot of tears that people have cried. When somebody has a heart attack in the house, that doesn't affect just one person, that affects the whole family. And let's see if we can do what's best for each other. Let's see if we can do what's best for our patients. And so that's the message I have to bring to you. So Sue, I appreciate the time.
Thank you, doctor. I do have a question. So, when you wrote this book, what brought you to this point where you started to, because you had mentioned when you looked at the mouth had barriers that didn't when you were first educated. What brought you to this point where you felt compelled to write this book and to talk about this? Because really everything that you explained, even as a dental hygienist, but if I'm a lay person, I understood crystal clear what you were trying, your message. So what was it that encouraged you or prompted you to go ahead and write this book?
Frustration. Frustration.
Right.
The hospital doesn't want to do it. And I thought you were supposed to be a healthcare institute. I thought that's one of the things you were trying to do. And if the physicians don't have time, and again, today most physicians are hired by corporations that they set the schedule. There's got to be some way of getting this information out. In the back of the book, and I've got a copy of it right here, but in the back of the book, these are all the resources. I don't know if you can see all that, but there we go.
Sure.
But these are all resources. It's not me. There's tons of really true researchers, really true experts that have done this research. Go back to 1934. A physician by the name of Wilbur Post wrote an article for the Journal of the American Dental Association saying that diseased teeth should be removed even if they have no pain, because that's the source of many problems, many medical issues. He was a physician writing to the American Dental Association, 1934. In the year 2000, the United States Surgeon General did a huge report, Oral Health in America, that basically came to the conclusion that you need a healthy mouth to have a healthy body. You cannot have a healthy body with an unhealthy mouth. That was 25 years ago. How far have we come? And it's ignored. If you ignore the mouth, the body will be sicker.
Yes.
That's just
Yes.
so.
That's just a fact, right? Wouldn't it be nice if we had dentistry embedded into hospitals, into assisted living? We know from those of us who've taken care of our loved ones, our parents, for example. My mother was in a nursing home, assisted living, and I was, as a hygienist, I went in and I basically brushed her teeth in the morning and at night because I saw her every day. That was something that the nurses, I guess they felt that they didn't have time for it, or they just didn't feel comfortable doing it.
Well,
And we all brush our teeth, including the nurse, but it's just maybe perhaps making that a priority for our patients as well in a hospital setting for nurses to do that. What is
well,
your experience with medical
well,
personnel and
in the hospital, when they have people on ventilators, they do have people go in and clean their teeth because they know that if they inhale the oral bacteria, they have a greater chance of pneumonia. They know this. So this is what bothers me. It's not ignorance. You can fix ignorance. They already know this. So why don't we continue that over to the other patients?
yes. Well, I'll tell you, one day we will all, and I think we're getting there when it comes to, medical dental integration. We work toward that goal. And I do think by your lecturing and your educating dental professionals, medical professionals, the public, that is what it's all about. It's about educating. And I think that sometimes, like you said, we have time constraints. We just don't have time. We feel we don't have time, but like you said, we can save lives. And I do think as hygienists, we are preventive specialists. We understand the importance of what we do. I just, it's been my experience. Sometimes patients don't want to hear it, but we have to say it anyway. It is our moral and ethical obligation to our patients. So thank you. I appreciate, I enjoyed listening to you so much, Doctor. And we look forward to having you back
Oh,
after your next book.
I don't know about that. So, but no,
Tell me very quickly. I know that you do a lot of volunteer work. Just enlighten us a bit about what you do as a retired dentist. And I know you mentioned going in and volunteering your time. What else do you do?
well, that's the main thing is it was St. Luke's Clinic. It's a local clinic, and the people coming in there. When I was in practice, I didn't see this segment of the population as much. You had a few, but now you're seeing people coming in. They were, meth addicts. They're drug addicts. They horrible lives they've had. They got no money. They got no whatever, and they got sometimes horrible teeth in there. But hearing their stories is uh, that's really affected me in a more compassionate way. I mean, it's easier to judge people until you listen to them for a little bit, and they're like, "Oh, okay, now I see it." So that's one of the main things I do. But speaking to different groups, that's what I like to do is just share this information. I'm working with somebody on getting this out more through social media to where we can get uh, this information through not just Facebook, but a lot of the other social media. And if we can get people, once we get this thing up and going a little bit more, we'd love to have people share it, see it, understand, and then share it. That's what I tell people with the book, because I give books away, and which I don't know is always a good thing because sometimes you don't value what you're given for free. But my goal, I'll give it to you, but you got to promise me you're going to do one thing: share this information with your family, share it with your physician, share it with other people. You've got to share this information. And hopefully, well, it's kind of a grassroots effort, but let's get the information out there.
Well, I thank you so much, Doctor, and you have a wonderful evening. We appreciate it. I appreciate your being with me, and in the meanwhile, you will be presented. We will go ahead and this will be on all of our social media platforms. So for those of us who follow those are our audience who follows us, we look forward to sharing your information and this podcast. And we will see you sometime in the near future, I hope. You be well and thank you again.
Thank you for the opportunity, Sue. Thank you very much. Thank
My
you.
pleasure. Be well, doctor. Have a wonderful rest of your evening.
Thank you.